This center was started in the year 2021. When I say this center, I'm referring to the Sukoon Nilaya Palliative Care Center. The King George V Memorial Trust is a very old trust. It started in 1938 to commemorate the visit of King George V to Mumbai. And this land was then donated by a very famous family called the Jahangir family. We, the citizens of Bombay, owe them a great debt of gratitude. They donated these 7 acres of land to build, and in those days, what was a necessity, a beggar's home and a home for the destitute. Subsequently, this trust decided to build an infirmary for patients who were abandoned at hospitals like the government hospitals and municipal hospitals. And then it went on for years and years that way until in 2021, during the peak of the pandemic, we decided that we should expand the facilities of the infirmary and build for the first time in Maharashtra a palliative care center for those patients who were afflicted by diseases other than cancer. And hence, Sukoon Nilaya was born in 2021. The concept of palliative care was started way back in the 1950s in England. And in those days, cancer was a very prevalent disease for which there was no major treatment available. And lots of people suffered horrible deaths because of cancer. The pain, the suffering was immense. To treat these patients who could not be cured of their cancer, palliative care as a concept was born. And the idea was to improve their quality of life. And most of these patients who were referred to a palliative care center did not live more than 3 to 6 months at that point in time. And it continued like this. Palliative care meant cancer, meant end of life. However, it was realized by the medical profession that there are so many diseases where patients are suffering and lead long lives, 10 years, 15 years, 20 years, and throughout this trajectory of their illness, they suffer. With them, the families also suffer. So palliative care as a concept broadened its outlook. And under the umbrella of palliative care, a whole host of non-cancer diseases were added. And this concept became a widespread concept and was adopted by many, many centers in the West. Unfortunately, in our country, there are very, very, very few centers that offer palliative care for non-cancer diseases. Our center, the Sukoon Nilaya Palliative Care Center, is the only center in the whole of Maharashtra that offers a holistic treatment, holistic support for patients who suffer from non-cancer diseases. So this was the, should I say, the raison d'etre for this center. And our mission is to relieve pain, suffering, not only for the patients, but for their caregivers. So, to put it in a very concise term, we take care of total pain. So it's not only physical pain, we take care of psychological pain. Many of them have a lot of psychological issues because of chronic suffering. We take care of financial pain to an extent. We take care of social pain. Many of them are ostracized from society or don't mingle with society because of their disease. So the concept of total pain is what we take care of. Let's say somebody whom you love has a stroke, is paralyzed. Okay, he or she cannot move the right side of his body, they cannot speak, they cannot swallow, they have no control over their bladder or their bowel. And what does one do? Take them to the hospital immediately because they need emergent care, which they get at a hospital. And after 5 or 7 days of being in the hospital with all the tests and the treatment, etc., the family is very politely told that now you need to take the patient home. There's nothing more we can do for this person in the hospital. Now, at that point in time, the patient is still not talking, not speaking, not able to eat, okay, no control over the bladder and bowel, all right? What happens to this patient when he returns home? He is left to the mercy of the elements, so to speak. Of course, he will have a doctor and he'll be given medicines, but the family is not in any way or shape or form in a position to look after this person, right? So here is where palliative care steps in and says, okay, the emergency medical treatment has been given to him, okay? Now we have to return him to whatever best quality of life that he can achieve after his stroke has been treated in an emergent fashion. So, such a patient who's paralyzed is admitted to our center with a family caregiver, okay? And this family caregiver is taught by our staff how to look after this patient and improve his quality of life. So he gets physiotherapy here. The caregiver is taught what physiotherapy to give him at home. He gets speech therapy here. The speech therapy is taught to the caregiver. He gets swallowing therapy, again taught to the caregiver. He gets every conceivable type of therapy that is required in his case. We teach them how to nurse, how to feed, how to make his bed without prevent him from getting bed sores, and so on and so forth. So, and at the end of his stay here, which may be 15 days, 18 days, depending upon an individual requirement, the caregiver is actually obliged to pass an examination on his care. So, when we are satisfied that the caregiver has understood how to look after this man or woman, then we send him home. And while he is here, he or she is here, they get every conceivable type of treatment completely free. They're not charged for anything. No therapy is charged for, no medicines are charged for, no kind of aids. For example, if he needs a walker, we don't charge for that, nothing. And when he goes home, our team will follow up with the patient, either telephonically or video call, or if they can bring the patient here, then we'll see them again here for long-term outpatient follow-up. We are now in collaboration with the Maharashtra University of Health Sciences, which is the apex university for medical education in the state of Maharashtra. We are also in association with the SNDT University, and now with the Tata Institute of Social Sciences, okay, the School of Skill Development, where we are training doctors, nurses, and psychologists, etc., in palliative care. So In essence, we not only treat patients, we not only rehabilitate them, but we are also in the field of education. And you must understand that palliative care of this kind is a very new subject. There aren't personnel who are available who are trained in the principles of palliative care and how to apply those principles. We have to create this cadre. So we are in the field of skill enhancement, skill development, and in the field of education.